I'm Jennifer Laine. I'm a pediatric orthopedic surgeon from Gillette Children's and also our medical director of research, and have been from the IPS with the IPSG since the beginning. And I'm very happy to be here tonight talking about what causes Perthes disease. So if you look online at what defines Perthes disease, you might come across some really technical terms. And I think it's important for us to be on the same page with just what we're talking about. So let me kind of break this down for you a little bit. So when you see a term like this, idiopathic avascular necrosis of the juvenile femoral head, really we're talking about kids. We're talking about the hip, or the ball of the ball and socket joint. We're talking about a loss of blood supply to the bone, leading to bone death, and a cause that isn't really known. So I'm going to give you a spoiler alert right away. We don't really know what causes Perthes disease. And so this is one of the reasons why so many of us spend so much time thinking about and researching this condition. And so I'll share with you today what we think we know and what we don't know. So starting out with what we know that boys get Perthes more often than girls, with a ratio of about 4 or 5 to 1. Kids oftentimes present with limp and pain, and that we see different phases on X-ray as the hip goes through the different stages of disease. We know that Perthes is due to a loss of blood supply to the femoral head, and that's why sometimes we get a perfusion MRI to look for the signs of that loss of blood supply, or maybe how much of the femoral head has this loss of blood supply. And we also know that the hip forms new blood supply, and the body absorbs the dead bone and heals with new bone. But as it goes through these processes, the femoral head can become fragile. But why does this happen? So there have been many studies looking into the cause of Perthes disease and the different associations with the disease. And so some of the studies are on environmental causes, some are on mechanical causes, others on genetic or associations with development and growth. And many of us that treat Perthes disease and study Perthes disease believe that likely Perthes is associated with multiple factors. And so I do want to take a quick pause and do a quick disclaimer that the information I'm about to present is representing the Perthes literature and may not be representative of you, your child, or your family. Let's go into a little bit of the literature on environment and whether environment may play a role in Perthes disease. Well, multiple studies have shown that actually the farther north you are, the greater the incidence of Perthes disease. There are other conditions like osteoporosis and MS that also kind of follow this pattern, but there has been an association with being farther north. Also, there's an association with Perthes, or having an increased risk of Perthes, with smoke exposure, whether that smoke exposure is during pregnancy, secondhand smoke during childhood, or even being in the home that has a wood-burning stove. But clearly not everyone with Perthes has smoke exposure. Then there was also thinking that there may be mechanical factors involved. While not every Perthes child is high energy, many of them have been associated with a motor expressive personality or an active approach to life. And actually it's been found that there's a higher rate of ADHD in kids with Perthes than in non-Perthes peers. So maybe if there's an association with repetitive small trauma. If you have a child that is more active than their peers, if they're jumping 100 more times a day than their peers, maybe that could play a role in getting Perthes disease. What about genetics? We get asked all the time by parents, is this genetic? And I would say that overall, our answer is we don't think so. And one of the best studies demonstrating this is actually a Danish twin study where they looked at 10 pairs of identical twins where one had Perthes disease. And they actually found that 0 pairs had demonstrated, or 0 pairs had the other twin with Perthes disease. And since identical twins are genetically identical, if you don't have it paired and identical twins, it most likely does not have a strong inherited component. So then you might ask, well, why do we occasionally hear that there's a slightly higher rate within relatives? And the thinking is that most likely relatives are in the same environment. So maybe it has more to do with that environmental factor. Now, there are multiple conditions that mimic Perthes disease, and so your provider may recommend genetic testing. And that's really to rule out some of these other causes that may, or not causes, but other conditions that may mimic Perthes disease, but aren't Perthes disease. And those can be some of the different skeletal dysplasias, which can be genetic conditions where you have differences of growth of bone or cartilage. There have been many studies on whether this is a clotting problem, and some studies support that, and some studies refute that. And I would say, in general, the clotting studies have been fairly inconclusive. And my own thinking on this is that if this really is a clotting problem, why does it affect only the hip and not other parts of the body? And lastly, there have been multiple associations with Perthes and some differences in development and growth. Perthes kids are oftentimes shorter for their age, and they sometimes are a little bit more delayed in their skeletal development. And so sometimes doctors will order a hand x-ray or a bone age to look to see how their bones are aging versus their actual chronological age. And there's also been a study showing that possibly kids with Perthes may even have smaller blood vessels. So what can we conclude? Well, probably multiple factors are involved. It can be associated with being farther north, being slightly smaller for your age, possibly having smaller blood vessels, maybe being more active than other kids, or possibly having smoke exposure. And so because we think that there's possibly so many different factors that are involved, this is why it's hard to get to the bottom of this. But we really believe that the best way to find answers is by bringing multiple experts together from different centers across the globe, pooling their knowledge and expertise. And this is one of the many reasons why the IPSG was formed, to find better answers to these important questions for patients and families living with Perthes disease. Thank you.